We're speaking with Patti Cullen, Care Providers of Minnesota today. Hi, how are you doing, Patti?
I am. It's good to be with other people
It's
for the
good
first
to get
time
out,
in a
isn't
long time.
This
yes.
is my first outing, I admit.
And my first outing since February of 2020.
Yeah. Okay, so we're in the same boat. Well, very nice to have you here.
Yes.
So, it has been a hard row ever since we started getting sick, and the media has kind of given us a bashing starting from the beginning. And well, let's see, China also got blamed for this, but then so did Washington, and then so did New York, and then all of a sudden it's nursing homes. But tell us your experience with the media and what has happened and what you have done and what others have done.
Yeah, it has been, we had one or two facilities that were very large that had a high number of deaths at the beginning. So not focused on everyone. There were some buildings that would actually advertise they were COVID-free. So don't worry, come send your loved ones to us. But early on, people didn't know things, right?
No.
And so we have been working through this whole pandemic very well with our state public health agency. And 3 times a week meetings, figuring this out. The emergency operations and all of that. So we actually deferred some questions, media questions, to the experts. Public health, the state epidemiologists, they took a lot of the questions. We participated with them on some press conferences early on, some virtually, some separated out, to get the word out about testing. So for each thing that happened, we actually worked with the media and the state agency on stories. So we didn't have any PPE. We were wearing garbage bags. We sent those pictures to the media to say, we now know that we have to protect, as the science evolved, we learn more, we know more, we need help. Provide us with testing. So the media actually helped us tell our lobbying story on they need to get tests so that they know, because we know now that people could be asymptomatic and walk in our buildings. The one issue we had with the media through this all was families who were just heartbroken. And so they did a few stories calling them prisoners, and that kind of thing. And we had to keep saying, here's the regulations, so we had to do a lot of education of the media. But I would say 90% of the time during this pandemic, they were helpful to us. So vaccinations, right? So now they really want to know how the boosters are going to go. They really want to know what's the impact of the vaccinations on our staffing. So we took it upon ourselves to be proactive. We did a big press conference last week, talked about all our vacant staff positions right now, that people are leaving the profession because they are exhausted, because they have been our heroes. So we were able to flip the stories pretty well. It doesn't mean that there weren't a few individual buildings that had the huge outbreaks that the TV cameras were just swirling around, but they also managed it because they would share stories about how they actually work with the state to have a COVID wing to be able to take COVID positive people in their buildings who needed care. So they did a pretty good job of pivoting the stories, and then we used the information that AHC and Cal pulled together about the studies. Why do some buildings get more COVID than other buildings? And those studies were really fabulous to say it's the community spread, it's size of your building. So we just kind of factually walked through all of that, which made it difficult for them to do slamming.
That was pretty brilliant, Patti, to start with the science, and you jumped on the science before there wasn't any science.
Right.
You just said there has to be science.
Yeah.
And you went looking for the facts, and then you just kept on all the people who were supposed to come up with them, and then you kept reporting them, and you kept all your members doing the same.
And
I don't know how you did that.
Well, we did, for the first year, we did daily COVID messages to our members. Now we're only doing it 2 a week, but there's still enough information. And we would do free webinars for our members about once a week, just to update them, make sure you tell your stories. Here's the facts, just very bullet point. Tell them you know what you're doing infection control. Explain to them why they can't visit. So I think the more you communicated, the better it was. I do think that partway through, it used to be, they would look at the statistics that our state public agency puts out every day on number of deaths.
Right.
And initially, 90% of the deaths were in our settings.
Of course.
But then we all got vaccinated. We have 90% of our residents, 94% of our residents in our state are vaccinated, so the death rates have flipped.
Sure.
And the deaths are coming from private residents now. So initially we were always looking at that number to say, okay, we just want to make sure it's not all from our settings, that it just doesn't look like, don't bother, that only frail old people are going to die from this, don't worry.
Right.
And ageist comment as it was, that's still what some people were saying at the press conferences. Well, then it didn't become a nursing home disease. And then when it didn't become a nursing home disease, we were able to really control the story more.
That's an incredible story.
Yeah.
And that's what everybody should be doing. I mean, you follow the science, and you trusted in the science, and it was hard. It was hard because information was coming from all over the place, left and right,
and it changed. And
all
so,
the time.
Like even the CDC trusted partners that we were. So it would be, here you do this, and then 2 days later it was something else, and then we'd have to tell our members, throw the old stuff out. Because they'd be collecting and they'd say, wait a minute, we're in outbreak testing, we have to do it here. And we said, no, that was last week. This week, this is what you have to do. So it's also confusing to families too, because some weeks they can visit, and depending on community spread, some weeks they can't in certain places. And so it's hard for them too.
Or what the various agencies are telling them they can do. I mean, the idea of when you could start opening up your facilities, that was pretty murky. I mean, CDC, first of all, said, yes, you should be, and then backed off, and it was like that all over the place. It wasn't
and then the two federal agencies didn't align, CDC and CMS, and I'm from Minnesota, so we have cold winters. So the idea of outdoor visitation, when they were saying, well, you could do all outdoor visitation, I mean, we did have heated tents, that had open air, but it's still really cold. So there were times where I'm sure other states, they were able to do outdoor visitations a lot longer than we could.
Certainly a lot longer,
Yeah, so that was a little bit difficult because we couldn't really, until vaccination starts, there really wasn't
an alternative, a way for visiting.
Right.
Well, that's an amazing story. I'm so glad. I'm proud of the way your whole state behaved.
Well, and it's still
Stuck
going
to
on.
it.
We still have really high positivity rates in Minnesota, but it's not in our setting, it's in the communities, because kids went back to school and there's no mask mandates, and so...
Well, in Florida, they went back to the beaches.
They did.
Yeah, the governor sent them back to the beaches. I mean, that was last summer. That was a long time ago.
But seeing the pictures,
it's like, just, what are they thinking?
Right.
Well, thank you for sharing your story.
Yes,
That's a very positive story. And
well, they're not always your enemy.
No.
And so now we're working with the media on our workforce shortage story, because it is
good.
Where we're telling them what we need, and that, and their answers are, well, if you're short staffed, how can you take? I said, well, we're not admitting people. That's why they're backed up in the hospitals, and that's why we have this care crisis across it. So the answer is pretty clear. This has to be a valued profession that people want to work in. And so you pay more and you write good stories. This is where I got the media a little angled in. And you write positive stories about the heartfelt care that happens in these communities, not the negative stories about someone dying on our watch.
Well, it sounds to me like you've taken great pains to establish very good relationships with the media.
Well,
so that they trust what you say.
It doesn't prevent sometimes wild stories to come, but they call me. I can't tell you, there's not a week that goes by where I don't have a call from some media outlet.
Well, because you're a good source.
And I tell them
You tell it
facts.
like it is. You tell them like it is.
Yes. So that's it. That's my story.
Thank you so much, Patti.
Yeah, thank you.